In our 12 years on the air, we've seen remarkable advances in medicine, no doubt about it. There's been new treatments, new surgical techniques, even cures, but there's one area of medicine that appears to be going backwards. That's when it comes to maternal health care. The number of American women dying from pregnancy and childbirth complications has more than doubled since 1990. 135 American women a day face life-threatening complications related to their pregnancy. For some, it can even lead to death. A recent investigation found the U.S. ranked higher than any developed country in maternal mortality rate. American women are more likely to die in childbirth than women in countries like Serbia, Kazakhstan, Thailand, Costa Rica, and many other countries. In a country like ours with the latest medical advances, why are we so far behind when it comes to childbirth? So, Dr. Nita, I'll start with you. It's surprising to hear these numbers, given that we live in this healthcare system is meant to be the best in the world.
Absolutely. I mean, and to put this in perspective for you, American women today, we are 50% more likely to die during childbirth than our own mothers were. Like, that's how much the rate is increasing. And according to the CDC, about 60% of maternal deaths in the United States are preventable. So we should not be seeing statistics like this in the United States, like you said. And as an OB-GYN, I'm frustrated and angry and disappointed because I sincerely feel that when it comes to maternal mortality, our U.S. healthcare system is failing us. It's failing us as women, and we deserve better.
And let's dig into this a little deeper and talk about why these rates are so high. And joining in this conversation from the advocacy group Moms Rising, Vice President Monifa Bandele, join us via Skype. And Monifa, I want to ask you, why do you think maternal mortality rates are so high in the U.S. and also increasing in number?
We found like 3 big buckets that were causing these deaths of moms. One was preeclampsia, which was hypertension during childbirth. There's postpartum hemorrhaging. And I hope that we really touch on the feeling like healthcare providers are not listening to moms who are laboring. We know that doctors are rushed. There's high patient volume because of how health insurance works, because of how some hospitals are structured. Our system is failing our moms.
Dr. Nita, I mean, I know you're training, how well trained you are in the technology and for obstetricians to monitor the health of the mother and the baby during the process of delivering are better than ever. It's difficult for me to get a handle on why this is happening. What I'm sensing is that there's a certain part of society that is just underserved, and it's skewing the numbers in the direction we don't want to see it going.
Absolutely, you're right. Now, when we're talking about maternal mortality, I want to be very clear, this is impacting women all across America of all races. But when we look at the numbers, there are certain groups more heavily impacted. When we look at the highest rate of maternal mortality, it's going to be in the African American community. When you compare African American women to Caucasian women, to Asian women, to Hispanic women, African American women are 3 to 4 times more likely to die from pregnancy-related complications. In America, 32% of deliveries were by C-section in 2017. And if you look at the World Health Organization, they say that the ideal rate is about 10 to 15% for C-section. So that's something that we definitely need to work on here.